Good afternoon. I'm Mireille WEINBERG. I am with the magazine Capital. I'm going to introduce straight away Pierre-Yves GEOFFARD, who's from the Cercle des Économistes, who's going to give us an introduction. Thank you very much. Thank you for being with us. It's true that health is obviously an area that interests a lot of people. We're going to talk about prevention, which is something we don't talk an awful lot about, but actually does seem really very valuable. And there's a couple of things I want to say about it. If we talk about prevention, what we need to be thinking about is the diversity of populations and situations that need to be taken into account. So we could talk about this in terms of social inequalities around health. What that means is that we can't reduce prevention down to simply the healthcare system. Why has the healthcare system been built around a curative approach to treat sicknesses, to deal with the disease of patients, but it has never been designed in order to prevent disease and help people to stay in good health? That's really not the way in which the healthcare system has been developed. And this is really very clear. I'll give you one or actually three figures about this. In terms of the prevention, makes up 2% of spending on healthcare in France. Can that change? Well, no. Yes, there are definitely some countries that can change that. And they're working on that. In Great Britain, for example, we're seeing that happen. And we could do that in France. In 2021, the proportion went up from 2% to 5.5%. So when we need to do it, we can do it. So why is that? It's because of the COVID tests and COVID vaccinations that really took this figure up. So these were two prevention actions that were really very expensive, but we had no choice. This needed to be done. And when we have no other choice, we managed to do it. So what does this actually mean? There's this diversity of populations. We can see this in terms of attitudes to vaccines. There's strong social inequalities. Another figure, which I'm just going to give you here, the spontaneous acceptance of vaccines within the healthcare system. Doctors, 99%, nurses, 75%, and among auxiliary nurses, we're talking about 40%. So how did we get here? Well, we really need to see and understand there is a diversity of population, a diversity of people's situations to help us to understand why some prevention actions are less accessible to some people more than actually the healthcare system is. So that means we need to produce a whole number of different actions. We need people to get involved, everyone to get involved. Businesses, insurance companies, healthcare funders, a whole number of different players that are not represented here today. But we also need the healthcare system to get invested here, in particular the pharmaceutical industry as well, so that there's not only focusing on curative drugs, and we need to get everyone involved and try and coordinate all of that together. So we're going to talk today about a number of different actions that could be put in place to try and improve prevention in France. Thank you very much, Pierre-Yves. That was really very helpful. So we've brought together a whole panel of speakers from the world of the healthcare who work in prevention. They're going to talk to us about how they do it. So next to Pierre-Yves, we have Thibault DESMAREST. You are the president of GSK, which is an English pharmaceutical company. Next to you is Thierry, who is the Syndicat du Médicament. Next to you, there's Sophie MORVAN. You are CSR director of your group. There's MERCIER, who's the senior director for Europe of Integrated and Global Solutions for W2W. And then we have Mrs. Signe, who is Minister of Social Protection in Estonia. So I'm going to ask my first question to Mr. HULOT, who is the president of the syndicate that brings together all these different drugs companies. So Obviously, we know about the vaccine, but are there other actions that pharmaceutical companies are developing for prevention? Well, of course, as you said, generally we tend to think about drugs companies producing drugs for when we're sick. And yes, that's a significant part of our role. But actually, what we wanted to try and do is to ensure that all citizens stay in good health, and when they have health problems, to come quickly back to a place of good health. So yes, prevention is all part of this. Of course, there are the vaccines that we all know about, which are also drugs, but also these treatments that are available that make it possible for people to stay in good health. What's important with drugs is to use them well, because if you use them poorly, you can have a negative impact on your health. So we're really working very hard on these areas. And so this afternoon, in order to perhaps encourage some questions later on, we're in a country that really has a very paradoxical approach. Since the beginning of time, we have got a Ministry of Health, a ministry focused on staying in good health. But 90% of the work that they do is focused on treating sickness. So now we've changed the name of this ministry to talk about Ministry of Health and Prevention, as if prevention was damaging to health. But we really need to change our approach, and we as drugs companies want to change the situation. We want to see that drugs are part of a whole treatment process, and I think we'll hear from Thibault earlier with some very specific examples. So, Mr. DESMAREST, you are a pharmaceutical company. You produce drugs to treat people. What is the role of prevention in terms of what you're doing? Well, first of all, thank you very much for inviting me and for putting this subject on the table, because it's really not a very common theme that is covered, but it's really a very critical issue. It's both in our societies, but also in our economy, because we talk about healthcare budget a great deal. With a British group like GSK, we are focused a lot on curative treatments, but also on prevention and vaccines. We have the biggest portfolio of vaccines of all pharmaceutical groups, with representing about 20% of what's available on the market today. And for us, this is a real priority, investing in prevention, in research for these vaccines, for a very simple reason, because we think it is the best way to prevent people getting sick. Of course, once people fall ill, there are solutions to that, but we want to try and prevent sickness. So we can do this through individual approaches, through individual protection from vaccines, but also we can protect through protecting the people around them in their environment. But vaccines also prevent the continuation and the development of diseases. And we want to develop, for example, solutions, vaccines, for example, against different respiratory diseases that can affect us, or against shingles, or the shingles virus, because what can happen is that people can end up quite vulnerable, exposed to these different viruses. The goal of the vaccine is to protect environments, protect their environment, protect the people with whom they are with, and this really has a very significant economic impact. We could talk more about this. So over these couple of days, we've been talking a lot about policies and politics, which is really very important. But we need to understand that in recent years, there's been a real expression of strong policies in these areas. We have visits in France at 45 years old and 65 years old for people to have preventative visits to the doctors, which are fully reimbursed by the social security system. Now we have as well nurses and other professionals who can give vaccines and prescribe vaccines. You talked about the fact that we've got prevention in the name of the ministry. At least we've got prevention there in the name. It's better than before. So it's true that we haven't yet seen lots of success, because when you see the level of investment in France with regard to other countries, we're the 19th country out of 27, so we're not really at the top of the league here in terms of budget for prevention. 2% is in Europe, we're about 3.2%, and if you look at the budget that's allocated to vaccines, it's 0.2%. Was that before or after COVID? That's regardless of COVID. COVID, we hope, will just be an exceptional case. But this nevertheless remains very low with regard to other governments, Germany and Italy, who are investing a great deal in vaccination and prevention in general. Mrs. FERREIRA, MORVAN, your foundation is the Foundation April. So you were talking to me about this earlier. You have a particular approach to prevention. It's not general prevention. What do you really do with your foundation? So in our foundation, April, we seek to understand why big prevention campaigns that have been put in place until now don't work or don't work very well. For example, that campaign about eating 5 fruits and vegetables a day, it only reaches 13% of the population. So we're asking the question about once people have the information and they know what they should do, why don't they act? So what we're trying to do is to look at behavioral science and see what levers we can move to help people to get into action. So yes, of course, impacting their environment, where people work, where they live, the way in which people are educated, the information they get about healthcare. But what we particularly want to do is to make sure that prevention and also health promotion is also really clear, because when we talk about prevention, we're talking about risks, but when we talk about promotion, we're talking about the benefits for people, and that creates less fear. What we want to do is motivate people again for developing their healthcare. We want to help people to move from the big instructions that they might receive information into what can I do in the short term in order to get health benefits personally, because most of us are more focused on the present than the long-term future. So we want to help people to understand, for example, why it's good to eat 5 fruits and vegetables a day, what the impact will be on the body, and help people to understand the immediate impacts of this particular action or any other actions. That's what we're doing with the April Foundation. So that's something that you're doing, but it's not just within the insurance group that you represent, but it's actually a kind of research project that you're opening up to the whole community. Yes, the foundation is a tool of general interest, and we've just been running a 3-fold study on the health of 18 to 25-year-olds, so digital natives, our students, our children for some of us, the future parents of the upcoming generations, and then particularly for those of you who are heads of companies, these are going to be your employees in the future. So we've done a study with them, and then all of our results are available openly in open source. You can access the data and get the raw data to use it as you will, and then the different experiments that we're going to do with associations, with healthcare professionals, and also with players from outside the healthcare system, because prevention is not just about the healthcare system, it's also people's jobs, it's about schools, it's about housing. So what we want to try and do is to measure impacts and make available the results of these studies to others. Mrs. Mercier, I forgot to say earlier where you work. You represent Willie Stowe Watson, the international broker. So you are trying to sell social protection systems to big European businesses. So we've seen what pharmaceutical companies are doing, but businesses also have a key role to play. Tell us how you can encourage prevention in some branches, in some big corporations through your insurance contracts. So I'm just going to start with a few figures, because we often do surveys and benchmarking with businesses and employees. So 11,000 businesses and 22 million employees we have surveyed. And so the results of our survey shows that 26% of employees say they have poor health, and 40% of them say they have a high level of stress, which is above average, an above average level of stress. And then about 26% of employees say only 26% say they have a good living style in terms of in terms of health. We also look at issues around smoking and alcohol. So all of this says that there's a real urgency in terms of the health of employees. The good news, because there is good news, is the fact that businesses are really aware of these issues, and businesses have been moving forward these issues, particularly encouraged by the period of the COVID period. So you've heard of day care, we care, Veolia Care, all these different programs that businesses have put in place in order to ensure that employees have a social protection foundation basis around high risks and around prevention as well. And in terms of prevention, we can really do quite a lot, and this is how we can help businesses in prevention. There's prevention in the physical aspect, and then the prevention that we talk a bit less about around mental health. I think we'll talk about this a bit more later. In terms of physical prevention, this takes a number of different aspects. There's, first of all, education of employees. Often employees don't know what they have right to through Social Security, but also through their healthcare insurance coverage. So they don't access healthcare, or they don't do the freely available medical appointments to just review and to do a checkup. And so there's also linked into these campaigns, for example, like the 5 fruits and vegetables. We've been backing up these campaigns about lifestyles and cancers, for example, that can be linked to poor lifestyles. Right now, we have 140,000 cancers that are being experienced, which could have been avoided because they're linked to environmental and other factors. So there's communication with employees. That's the first aspect. And then, secondly, we put in place supplementary checkup appointments in addition to what's in place through the standard social security system. In addition to these checkups, we also offer second opinions from doctors around cancers, for example. And we put in place a whole range of measures around physical health with applications to help you do sport at home, applications that help employees to develop good behaviors, good lifestyles, so that their health is impacted less negatively. And then there's a whole range of work that we do in terms of working conditions and the environment at work. So we've focused on programs like cancer at work in order to limit the impacts of cancer on employees. So here's a whole range of things that we can do. We were saying earlier, when the public authorities do prevention campaigns, they often have a very broad reach, but often it misses the target. So prevention actions are not always very targeted. In businesses, is it more targeted and therefore more effective? Are you able to measure it? Yes, we managed to target it because we do analyses of different the results of different professions. So if there are more cancers associated with particular professions, then we'll put in place particular specific prevention campaigns. For example, for breast cancer or skin cancer, we will have, for skin cancer, medicines coming in to check moles on the skin, etc. So, Mrs. RIISALO, in Estonia, you've focused since COVID on prevention policies in terms of mental health. Can you tell us about how you implement that? And please explain why you focused on mental health and how you move forward these prevention areas.
Yes, I feel myself quite weird here because I'm a social worker, and the people here are more or less background from the economy and health, which is different. But prevention is very important in Estonia. We try to do everything to start with the prevention, helping people. As you're told, this is the question of social inequality, and we really need help. But I specifically would like to pick up one issue on the prevention, which is mental health. During the COVID, we recognized that our people actually lacking professional help, and the system in Estonia, and I believe in many countries, relied on very high qualified specialists, but we are lacking the professionals. That's why we started a few years back to create a system where the communities can offer to the people really low-intense services. What we see, for example, last year we had 4% more people than year before who got diagnosed anxiety or depression. And we see that among young people, the problem is even more difficult. COVID meant for many pupils gap of education, but also isolation, which is very difficult to prevent in such situations. And that's why we are building now in Estonia a system where, first of all, there is on the schools, working places, possibility to get information how to help yourself. And really in Estonia, very many enterprises give opportunities, lections to the staff they have. Then the second is e-courses for the people. If there is some bigger problem, the people themselves can go through the e-courses to help themselves. And then the community-based services, which are not clinical psychologists, but different kind of therapies. And finally, of course, there is still need for high qualification psychiatrists and clinical psychologists. This is what we are trying to do in Estonia, and since we started 2 years ago, we have 3/4 of municipalities who are offering the services to their people. In addition, obviously, the schools, they have school psychologists for the children, but to the local people. And what our social workers said, they saw absolutely different target groups coming ask help, because when before people came because of poverty or some other social problems, now ordinary people who have work, who have a place to live, they are coming to seek for help for the mental health.
Thank you. Monsieur Hulot, on a vu que chacun des intervenants finalement du système de santé.
So we've seen that each player is doing what they should be doing at their own level in terms of prevention. What do we need to do, Mr. Hulot, to move things forward at a higher level? Well, lots of things, I think, but perhaps we could start with what would be perhaps straightforward, but it would actually be the most complicated thing to put into place. We live in a country that focuses on healthcare budgets. We go through this budget process, the social security budget, which is debated every year around September and October, and we try and decide how much we put into the social security system, how much goes into drugs, and we decide that prevention is, at that point we decide that prevention is the tiny little part. And why? Why? It's because we have a restricted budget. We need more money, and when we add it all up together, we end up funding what's urgent because we've got no choice. But in terms of prevention, if we spend €1 now, we might save 20 euros, but it will be later, after 31st of December next year, because we tend to think in terms of disease starting on the 1st of January and rolling through to the end of the year. We really need to review our way of putting in place this annual debate. We need to have program laws for healthcare and drugs. We need to put in place ambitious prevention systems. Solutions. We know what the solutions are. We need the political courage to implement them. In terms of pharmaceutical companies, we are seeking to propose solutions in order to improve healthcare treatment systems to make sure that patients don't receive useless treatment, so that people don't become sick from the treatment that they're following. That's also part of prevention. And we also want to work with businesses. Maud talked a lot about this. We are in the private sector, and we have a responsibility to communicate prevention to our staff, to explain, to put in place systems through supplementary insurance systems, and do everything that what the social security system is not currently able to do. It's not enough simply to say what's not working. We also can put in place education in our businesses, education in our families about the importance of prevention. So I'm a pharmacist. I can talk very quickly about public health here. Prevention affects all of us. After 65, if you are not vaccinated every year against flu, that means you are 6 times more likely to end up in casualty in the emergency room. So there's a lot of screening for cancers. Colorectal cancer screening, in many cases, helps us to avoid sickness. Many of our friends and family have these kinds of diseases, but only 70% of us actually test ourselves. We need to be more effective in putting in place these tests. But the more we prevent people from falling ill, more we will save money in the system, and more we will be able to fund treatment for those who really need it. So we need to somehow get into this virtual circle. In the coming months, we all really need to try and keep our compass pointed on this area if we want to preserve what is unique in France. If you are sick, in 5 minutes you'll be asked whether you have a carte vitale, the social security card. You won't be asked whether you have your bank card. We really need not to change that. We need to keep focusing on individual and collective prevention.
Monsieur Desmarestes.
Mr. Desmarestes, suppose we manage to implement a true policy for prevention, or at least when we do it, is there an impact? What is the economic impact? Is it visible? When I was thinking about it, here we are at the Rencontres Économiques in Aix. We're talking about linking the world, and one that something links is diseases. You see, there are no borders, as we saw with COVID. So this is really at the heart. It is prevention. We have seen talked about artificial intelligence. In Estonia, we talked about managing data to prevent, to understand. And this morning, we talked about how we can manage growth. What is the impact of this growth? Proposals that we can make, and we already do with the pharmaceutical industry. If we take prevention seriously, we will protect the economy. Because if today you invest, the study was carried out in the UK concerning vaccine, you've got a large return on investment. You reduce hospitalization. So we have bronchiolitis over 60s, 20,000 people killed in Europe, and a tremendous number of hospitalizations in Europe. A time when hospitals are already overcharged in winter. So if we provide vaccines, maybe improve the situation. Vaccine means also slowing down the progression of a disease. When someone has an infection, they're fragile. What are they going to do? They'll too much medicine. You know that we are somewhat have a problem with the supplies of antibiotics, for instance. Means that we'll have antibiotics for the person who really needs them. So it's a virtuous circle. It's interesting to see all the topics that we've been talking about today, even including CSR. Vaccine and prevention will mean that you won't have to travel to go and see your doctor. It will, if you're in hospital, it's 17,000 euros in here. So compared with the vaccine, it's very limited. It's a lot. But every dot is connected to another one. So that when we talk about prevention, it is a solution to protect our economy as well, and make sure that at the end we have economy. But what we want to be in good condition to come here. We want parents, grandparents who remain independent, autonomous, and what about medical care for elderly people and so on. Sophie Ferreira, MORVAN, you were talking about experimenting in a targeted way. Can you give us some detail? You talk about young people that you go and find on TikTok, or social networks. Well, when we study the relationship with health, particularly on social network where they express themselves, we see a number of things. First thing, for these generations, health is not an objective as such. It's just a means to have access to your life objectives, and in those you have financial success, professional success, personal development, and so on. And so to have a targeted action means also taking into account that health is a means and not just an objective. That's the first point. And the second point is this preference for what is happening now, here and now. Find systems which means that people can make a health gesture their own. If we talk about young people, well, we move away from that. After 50, you start getting screening letters because you're 50 or because you're just about to be 40. And this includes if you already have been screened beforehand. That's the first way to save money. And it doesn't mean that people are really taking on board the health issue. For instance, people can check, women can check their breast, and so on. So we have some concrete examples for young people and for the April Foundation. What we're going to experiment is a number of things. First, how can we use these different cultures linked to health that we find on social networks to make sure we address young people correctly, target them, to recruit them, and make sure that they enter a prevention course. And here we're going to work with the association fighting obesity, for instance. More than 8% of young people who are obesity, 21% who are overweight. There's actually half for adults, and we go and find them on social networks where they are. And how do we keep them in this prevention course rather than send them to be cured? So where young people are sent by the medical social departments, you need to get young people come along individually and make sure they get into a collective system where we will make use of them to go and address their peers. The question of peer-to-peer is extremely important because, unfortunately, what we see is really trust regarding health professionals. There tends to be a kind of mistrust when health professionals say something. So young people turn to the social networks without checking sources, turn towards a contact which carry emotion or shock content, or peers who experience the same thing and who will become health specialists because they had a pathology at some point. And we need to hear these testimonies. So it's important to have this peer-to-peer with health training, for instance. There are a lot of citizen approaches on peer training to go and address other young people. Mrs. Mercier, when you talk about prevention within companies, how do you help these companies to avoid the expenditures going too far? Can you limit it from an economic point of view? Yes, well, quite. There's a lot of prevention action which can be implemented. The first thing to do is to analyze what are the costs that you have on your health contracts within a company. Once you have analyzed the costs, you can start acting in an efficient way to be able to make sure that you avoid the medical drifting in expenditure. And to go along to what Mr. Desmaresst was saying, we worked with a company who had a health contract which was in a major deficit area, and it was due to hospitalization. And we found, we're looking at day hospitals for children. So very often when there were parents who had a child who was sick, they didn't dare take an hour off and take the children to the doctors, so they went directly to the emergency services with their child. And it is by analyzing this type of situation they were able to take measures to set up prevention to make sure that for instance, those people could have consultation, make sure that employees could have an hour or two off work to take their children to a hospital. And this improves the profitability of the contract and therefore expenditure. We also worked with a company who had a very high rate of cancer amongst its employees. We analyzed the reasons for the cancer. We set up screening for women above 45 years old. We all set up a second opinion with another doctor, and by setting up these measures, we found that it reduced the rate of cancer within the company. So it's by analyzing and setting up the right action that you can limit the drift in medical expenses, but it's interesting for the employers and for Social Security, because it avoids useless costs by sending people directly to emergency services. So this is RIISALO. Data, analysis of the health data is very important. You are the Minister of very high performance digital world, so you have a great analysis possibilities. Does it help you in terms of prevention?
Of course, which is very normal. We do not talk about that, but digital prescriptions is a normality in Estonia, and you can ask them almost during the day and night. But the one, I think, very important thing what Estonia did was the biobank about the gene data. And recently, almost 1/4 of Estonian grown-ups got information about the health risks, so that they can really take into account what is the probability, what is going to happen with them in the future, and they can behave accordingly and avoid some diseases. In addition, I would like to say that it's quite convenient in Estonia because 99% of public services are available via internet, and this is really 24/7, so people can be in touch with the state very, very easily. And Estonia was the first country who run the e-voting elections 2005. This is important now in France also, but we went even longer, so that last year when we had parliamentary elections, more people voted via internet than in these voting places. And next year, next autumn, we will have local elections, and then law has been passed in the parliament. It's also possible to vote via mobile phone, which is important because this is about the young people. If we are getting closer to them via these electronic devices, then the probability that they are coming to vote is bigger. And this is also very important to have a democratic society. The young people should be there. But yes, we are gathering health data, and this is always a question of the trust of the people, because it's very, very sensitive. And we have very carefully to explain people why we are doing that, when we share the data. And again, we are applying people disability and vulnerability status. And we are changing the data from one register to the other, just not to make people to come with the papers. But to do that, we really need the trust and understanding from the society, and we hope that we'll succeed to do that.
Est-ce que ça, à votre avis, ce serait possible?
Do you think it would be possible in France? Well, for the whole of the systems in France, prevention is carried by public authorities or major stakeholders with a very high financial amounts. And one of the keys, I think, of success is to have a program as close as possible to where citizens live, but also at given times in citizens' life. To give the example of young people, if you take a young person leaving the family home to go and study at the other end of France, there's a kind of isolation, there's stress linked to studies, and potentially there is preventive action in terms of mental health, which is necessary. When the young person has a job for the first time, there is specific action which is necessary, and same when they become parents. The relationships to health change over time according to these moments in life, and it's important to take them into account. And this encourages us to have shorter, better targeted action rather than major campaigns. Always measure the impact, learn, and share the lessons so as not to repeat mistakes. Thank you very much. I would just like to add, I think, listening to everything said, there is a need for collaboration. You see, there are lots of good initiatives in different countries, but also different industries. But you really have to look at the subject to see how we can collaborate between the public and the private, how the complementary insurances can help funding, how should we work with residential care homes for seniors. So there is a real subject which is political, which is really not on the table yet. Everyone is trying to work in their corner to do the best they can with their means and the impact which exists. But if we want to protect our economy and if we want to really have an impact, because the idea is to do this to really have an impact, we need to create a kind of consortium or collaboration. People who are, for instance, working in artificial intelligence to diagnose earlier, for instance. The pharmaceutical industry who could adapt the response according to the diagnosis. But the collaboration does not exist. I mean, of course, this is an ideal world where everyone would collaborate, but I think it's very important, and we need to think about something to be able to go ahead. I am amazed by what we've just heard from our minister, how at a state level they have, by analyzing data, they have managed to set up a prevention program. I think that in France we're very good at collecting data, but it's very difficult for access because there's a fear of losing the identity of a patient. It could be settled easily. There were several conferences this morning on artificial intelligence. We could have one next year on artificial intelligence serving prevention, and how in France we could get all the stakeholders around the table and have a very ambitious program giving better prevention to be less ill and spend less. Mrs. RIISALO.
To make better prevention, then we have need a secondary analysis of the health data we have. And this is next phase we are working with, and this is not easy. Now the question is of the trust of the public opinion and the people, because as long as the data is used for themselves, this is understandable. But if we are going to analyze the public health in general and make different conclusions there, then the trust is difficult to get.
Pardon. Non, et paradoxalement.
Well, paradoxically, most of us, we already share our health data. When you make an appointment on the Doctolib electronic system, we're sharing our sensitive information. When you make there are other cases where we share our data. It is the use of this data in a transparent way, the possibility of being able to play a part in the use of this data, the fact that you can put your data online or remove it. So we need to sort of educate the citizens regarding the data available. Of course, there is a lot of data available. There is some use which is made of them for research, but it takes a long time. It's 18 months. But what is missing in the health data available is a crossover with data on the lifestyle of people. Because if it's just based on the care and the health care, that health is also the way that people live. Well, it is a lifestyle to start with. Then it's essential to collect this data as well on people's lifestyle. Thank you all. So maybe we can take some questions from the audience. I'll ask you please to introduce yourself before you ask your questions. Now tell us who the question is for, please. Or if it's collective. Veronique Van Bench. I used to be in the health field, and I was told I was too much of a busybody, I think. So, and I was at, the hospital sort of going to push me away. There's too much economic concern and not enough concern for the patient in terms of health. I think we're already managed by finance. Well, that's what I've. If I talk about complementary health insurance, I've just come out of a symposium on the Olympic Games. There were not very many of us there, but they were happy. It was the first time we were talking about sports in the economic meetings. In talks of prevention, talked about the vaccine. I understand it, but that's not all in terms of prevention. Why did no one talk about schools? Why, as health insurance companies, why don't you go to see the children in schools? So they, for instance, they tell their parents to go make sure they cross when the light is green for them and so on. Could you what is your question? Because there will be other questions. Sorry. My question. What are the complementary health insurance doing? What are laboratories doing to do more prevention in schools?
Yes. We have good example from
Nous avons un bon exemple donc en Estonie.
Because in Tartu University, they worked out special program for the schools called Schools Calling for Move. And more schools are connecting with that program. This is not just that you have label on the building that we are the school, please put your children there. But this is very specific activities the schools from the first grade are doing with the children, including requirement that the children have to be outside during the school day. And I think this is very important to teach children from the early age to behave in a healthy way. And from the other side, school is the second place. The first place is the family. And that's why it's very important to give knowledge to the families. And the parental skills are also important, because very often the young parents do not know simply how to help their children to live in a healthy way. So parental skills are also important in Estonia, and we provide trainings for the young parents.
To answer your question, what can a laboratory do in terms of working with schools? What a laboratory can do is very often at child level. We have a lot of orphan diseases. We try and care this with her legitimacy to work on these. Because I think laboratories working in school, imagine in society today, it would quite justly be very badly perceived. So, but we work in a silent way. We help associations, foundations to provide education, and there are disinterested donations here. We need to find the molecule for the future, allowing a baby, a child, or an adult to get better, to cure, to heal. So we can provide financial support, but that's all we can do. I'd like to add something. Things happen in schools. You have a project. Unfortunately, with the change, it remained volunteering, but the Ministry of Education suggested that school started with 30 minutes physical exercise. And we know it's important at every age to reduce heart diseases, diabetes, and so on. Last year, I think, or 2 years ago, in colleges, secondary education, we talk about the vaccinations against papillomavirus, and we know the vaccination level has practically doubled by going where the pupils are, where at the age when they need a vaccination. We know when it was just campaigning with parents at home, it didn't always take place. To come back to what you're saying about foundations, if we look at the April Foundation, previously we developed two things on the nutrition for young people. So you can go and get in touch with young people with the means of a game. We talk about a game concerning right nutrition. This was done in schools, and in parallel, we developed work with the research center of Paul Bocuse Center in Lyon to develop a series of 5 videos on food for teenagers to avoid fast food and everything for parents. And these videos were designed by the teenagers themselves. We went to work with teenagers. We went to get in an association called Sports in the City. There are a number of things which exist. Obviously, there are not enough, but they do exist. But school is most definitely the best way to start educating to health. Jean-Pierre Ross. One day, a British doctor said to me, "You've got a social security system which is amazing, very sophisticated. Why don't you make more use of all of the data that you collect in your health system to make it a preventive tool, which could be an amazing one, even more so now, with the other tremendous tool represented by artificial intelligence." So you didn't talk about a medical file, for instance, on the internet. What the results of a few years launch? Why aren't we talking about it more? So a shared medical file. So in terms of behavioral science, by putting the people's names down, it means we're all in in it, but then we need to activate it. It's not always the case. And the other issue is not just talking to citizens, but a lot of work then needs to be done with professionals so that they include the information on what is called my health space. When you talk about a lot of work has been done on warehouses for health data. First of all, warehouses for health data coming from health data from the medical acts covered by Social Security, but you also have work to make the health data warehouses coming from hospitals and clinics, and this is developing in town practices to collect health data from, to get all of the information from the practitioners, and there's medical emergency services who work on it to want to collect all this information. It's beginning to happen. It means a lot of work because all the IT systems need to be harmonized. But then you have public players who will need a certain amount of time to elapse before they can use the data. But today it's about 18 months, but we've already gained 6 months over the last few years, and I think it will be coming shorter. And this is a challenge for the future. Thank you, Sophie. Well, I think we have run over our time, allocated time. Thank you all for everything you have told us, and see you all very soon.